So I'm one of the optometrists here in the Baylor Eye Clinic, and we have multiple optometrists, but also multiple amazing ophthalmologists. The one ophthalmologist that I work the closest with is Dr. Stephen Flugfelder. He is known everywhere around the world. He's one of our dry eye experts in a way. He sees a lot of patients with these complex conditions such as Stevens-Johnson syndrome, Sjogren syndrome. He sees a lot of corneal transplants, corneal ulcers. And so for these patients who are unable to feel relief just naturally with artificial tears or with gels and ointments and prescription eye medications, and there's no other solutions for them, he will refer them over to my clinic or one of the other optometrists here that does specialty contact lens fittings and see if they would benefit from a lens that is similar to a PROSE or a PROSE. And we try the lens on, and we usually have a consult with the patient before we start the fitting just to make sure they know about the process, they understand the process. They're aware of the insertion and removal trainings because that is very important, and the maintenance of the lens as well. And once they're in the room and they go through the fitting and they understand what it is and what the expectations are and how they can feel afterwards, the majority of the time they end up coming back for their actual fitting. So we work closely together. If there's a patient that I see that needs care, I will refer them to Dr. Flugfelder or any other cornea specialist here. And again, vice versa, he will refer the patient here if they need additional help or additional treatment. So any patient who has a more complex ocular surface condition or disease should be in a more customized lens. That is just the way that I think. A lot of these patients have different irregularities on the surface of the eye, and they may need something that's more customizable. And so the PROSE device is almost the most customizable lens there is on the market. And it's amazing. It's an amazing tool to use for patients who have a lot of maybe bumps on the eye or tube shunts from glaucoma surgeries. In Grace's case, she definitely needed the more customization based off the shape of her eye and the scarring over her cornea and the larger diameter size option. A lot of traditional scleral lenses do not come in these larger size diameters, and larger size diameters are oftentimes more comfortable and fit better because we're able to sort of balance the weight of the lens on the entire surface of the eye. And so most of the time our patients are a lot more comfortable and they get more coverage over the white part of the eye to protect from the environment and from wind and from dust getting into the eye. So I would say, if it was up to me, I would probably always fit a PROSE device, but oftentimes there are patients who may not need it. Someone that's a little bit less complex, maybe just dry, doesn't need a lot of customization. They can probably get away with a traditional scleral lens, but I advocate for the PROSE device for the more complex conditions, especially with patients that have Stevens-Johnson syndrome. And another benefit to it is that there is a longer fitting period, which means that if the patient's really sensitive at first and really in pain, we can take our time to fit them. We don't have to rush it and cram it in a 3 or 4 month time fitting periods like some other traditional scleral lenses. We can take our time, we can extend our follow-up care, we can watch them from month 1 to month 2 to month 5 and 6 and still be able to make the adjustments that we need, because sometimes these lenses will change depending on the way that the ocular surface is. If a patient's having a flare-up, the white part of their eye is going to get inflamed and swollen, and the lens is going to fit tighter. And so we have to adjust the edges of the lens and contour it in a better way to not make it so tight and to make it more comfortable. So there's many reasons for choosing a PROSE device over a scleral lens, and I think the top reasons for it would be more customization, more time, and also more ability for overall customization.
Thank you for everything you've done to me. Thank you for taking your time, patience, to actually hear me and actually allow me to be me and allow me to vent and complain, because I couldn't do that in the past. I couldn't say how I feel, but you making it so comfortable for me to be able to just express. You've been patient with me and allowed me to express myself, and I haven't been able to do that since 2016, so thank you.
Well, Grace has been just amazing in all aspects of being a patient in general. She really just sort of, I think she's grown a lot during this process, and I don't know if you see that, but I see that in so many ways, just in your overall view of life.
Yeah.
She actually got her master's degree during our fitting. Like, that's amazing. Like, I'm just so proud of her. It's patients like you that inspire me to be better for patients like you. I'm so happy to be your doctor and to be helping you through this process.
Thank you.
You're welcome.
Appreciate it.